Hey,
Hey, Kat. Good to see you as well.
good to see you too.
I sure can.
Perfect.
Give me 1 second here.
So welcome everybody to our council meeting for August. It's great to see everybody here. We're gonna go ahead and go around and do introductions. I will go ahead and start off. I'm Kat Hayes. I am the recovery specialist for the McLean County ROSC. And I'm gonna try and do my best to go down the
Yeah,
screen.
you're okay.
And I will turn it over to Carrie, and then we'll go with Barb and then Cindy. And then as Lakeisha did, if you're not able to use your audio, you can also just drop your name in the chat along with your organization affiliation. So
Awesome.
Carrie, take it away.
Thank you, Kat. Good afternoon, everyone. My name is Carrie Knapp. I am the Associate Director of Community Health with Chestnut Health Systems, helping serve the McLean County ROSC. Happy to be here today.
Hi, I am Barb from Levy, and I'm a community health specialist supporting McLean County ROSC.
Hello, my name is Cindy Alcazar. I'm with Promise Healthcare. I am outreach health navigator.
All right, we'll go to Emily with Brightpoint, Tim Kane, then to Doug, then to Selena.
Hi, everybody. My name is Emily. I'm a community services coordinator with Brightpoint in the Scott Early Learning Center.
Hi, I'm Tim Kane. I'm a counselor at Student Services with Heartland Community College.
Hi, I'm Doug Bernius with Heartland Community College in the Recovery Support Program.
Hi, I'm Selena Nolan with the McLean County Health Department and the Behavioral Health Program.
All right, and then we'll go to Fran, then Jonathan, then Nolan, Randy, and Michelle.
Hi, I'm Fran Ingram. I just took a new position as coordinator of Sangamon County ROSC. And I also work for Family Guidance Center.
Great to have
Thank
you
you.
here, Fran.
Thanks.
Hi, my name is Jonathan Baptist. I'm a community health specialist with Chestnut Health Systems, and I work on the Being Parents Project.
Hey everybody, I'm Nolan Recker, and I am also a community health specialist here in Central Region with the Center for Community Engagement, specifically the Faith and Recovery program or project.
I think I'm next. No, Michelle, you go first.
Okay, I was just waiting for no one to talk, and because I was lost where I would come in. So my name is Michelle Cope from the Bloomington Public Library. I do community engagement and drive the bookmobile.
Okay, now I'll go. I'm Randy Derrig. I'm a prevention coordinator at Chestnut Health Systems. I oversee our BN Parents Substance Use Prevention Grant, as well as our Narcan program for the county.
All right, and we'll go over to Miss Abby with Brightpoint, then to John if you'd like. I know you dropped your stuff in the chat, then to Sarah, then to Sandra, and then to Kevin.
Hi everyone, I'm Abby Behrens. I am with Brightpoint. I am the case manager coordinator with the Butterfly Project.
Perfect, and I could go since John dropped his. My name is Sarah Bitstam. I'm the embedded clinician with the Normal Police Department.
Okay, go ahead. I was just going to say, can you provide a friendly reminder with who is next?
Yeah, I was gonna say if John wants to say something, he can. I know he dropped it in the chat. Otherwise, on to Sandra.
No, I thought I was after Kevin, but I'm Sandra Beecher from Gateway Foundation, and I am the Senior Business Development Coordinator and also the President of Central Illinois EAP Employees Assistance Program. Thank you for having me.
Good to have you here.
Hey, can you all hear me okay?
We sure can, Kevin.
All right, great. I'm also using that the phone today, so I'm learning some new stuff as well. My name is Kevin McCall, and I'm the Director of Behavioral Health Coordination. Thank you very much for having me today.
All right, we're continuing on our list. To Danny, then to Alicia, then to Courtney, then to Natasha, and then Marisa.
Hi, everyone. My name is Danny Sorbis. I am the Regional Community Mentor Liaison for DuPage ROSC in Region 2.
Oh, glad to have you here.
Thanks.
Hi, my name's Alicia and I'm a case manager with Fuse.
I'm Courtney. I'm a community outreach specialist with Family Guidance Centers, and I'm also part of the Sangamon County ROSC.
Hi, my name is Natasha Nunu Ponder, and I am the Community Integrations Coordinator for the McLean County Center for Human Services.
And then we will go ahead. Did Marisa go already? I apologize.
I'm sorry, every time can you all hear me?
Yes, we can. We can.
So hi, my name is Marisa. I'm with McLean County CASA. We don't have really too many updates right now, except we're graduating a new class.
Oh, congratulations.
Thank you.
And then we'll go ahead and go to Autumn and then to Ryan.
Hey everybody, my name is Autumn. I'm a community health specialist at Chestnut Health Systems under the Center for Community Engagement.
Hi everyone, I'm Ryan Lacoste, Area Director with Best Buddies in Central Illinois. We support people with disabilities through friendships, jobs, and leadership development.
And my apologies, I forgot the last person who was on here. They are from the Heartland Community College CRSS program. Go ahead and tell us who you are. That would be our person who dialed in on their phone. And if, of course, if you're not wanting to go ahead and tell us, that's all right too. I'm going to go to Alex real quick and we can come back to you in just a second. Oh, are you with us, Alex?
Yes, I am.
All right, we were just going to ask. So let's just go ahead and take a moment to collectively take a breath and inhale. And hold. Just give us a little bit of a centering exercise, and I will turn it over to Carrie to launch into our discussion topic for today.
Awesome. Thank you so much, Kat. Before I forget, I'm going to go ahead and click record so we can upload this meeting to our YouTube channel. Alrighty, everyone, we are going to go ahead and dive into our conversation today. Again, thank you everyone for joining us. It is such a pleasure to see so many friendly faces on this afternoon call. So we appreciate each of you taking some time out of your day just to be present with us and engage in a conversation around harm reduction. That is primarily what we're going to be talking about for our meeting today. Our ROSC Council team was really getting together to plan out our meeting for August, but also looking at the end of August, we recognize that that is Overdose Awareness Day, or International Overdose Awareness Day, and that is August 31st. So today we really just wanted to have a conversation around harm reduction, as again, we're taking a look at that really important day at the end of this month. For those of you who are unaware, International Overdose Awareness Day is the world's largest annual campaign, really aimed at ending overdose, but also remembering those who have lost their lives to overdose, and also acknowledging the grief of family and friends that maybe have been left behind. The 2020 theme for International Overdose Awareness Day is recognizing those people who go unseen. So this is really all about acknowledging people in our community who are affected by overdose, but might go unseen in their crisis. So ultimately today, this is a time to remember and a time to act. And as we move forward in our conversation today, we really encourage each of you to think through not only how we as a council, but also as individuals and also as organizations can work together to help end this crisis. So what we do know, and what I kind of want to start off with our conversation today, is that overdose deaths are preventable. And today's conversation, again, is going to be focused around harm reduction, which is really ultimately the practice of unconditional love for people who use substances. So you might be asking yourself, right, what exactly is harm reduction? We oftentimes hear this term in meetings or in trainings throughout our community. You've heard this term several times on ROSC Council meetings, but really it's important to understand that harm reduction can look like a wide variety of things. At its definition, harm reduction is basically just a set of practical strategies and ideas that are really aimed at reducing the negative consequences that are associated with a particular behavior. So as you can see here on your screen today, many of us use harm reduction strategies each and every day, whether or not we recognize them as being harm reduction. So when we are putting on a seatbelt, when we drive a vehicle, when we stop at a red light, when we put sunscreen on before going out on a sunny day, or even when we're washing our hands of germs. Those are all examples of harm reduction. Each of these really prevents a further consequence from potentially happening. So again, today we're going to be discussing harm reduction as it pertains to reducing the negative consequences of substance use. Harm reduction really is also a movement for social justice, which is built on a belief in and a respect for the rights of people who use substances. Harm reduction is oftentimes grounded in the principle of meeting people where they are at, but also not leaving them there. So as you can see on this screen, things such as Narcan or naloxone, fentanyl testing strips, syringe exchange programs, etc. Those are all just a couple different harm reduction strategies for substance use. So when it comes to alcohol and drug use, many people think in terms of what we consider to be harm elimination, or believing that complete abstinence from substances is the only option. This is very similar to maybe telling someone who was in a car accident or maybe even received a speeding ticket that they should never drive a car again. Or maybe because someone was sunburned, or maybe because they became overheated, that they should always abstain from being outdoors when it's sunny outside. The good news is that there are tools to reduce harm for all of these behaviors that have known risk. Oftentimes people might argue that giving people sterile syringes or clean tools or Narcan incentivizes substance use, or maybe even leads to substance use. Really, as we take a look at some of the research that we have studied and known and gathered over several years, we know that people are going to use substances whether or not they have these resources or not. So withholding those resources from them doesn't necessarily prevent that use from happening. It oftentimes just makes it more dangerous. Today, we're going to be examining a couple different benefits of harm reduction. Ultimately, harm reduction really does lead to safer use, moderation, or even abstinence. And all of those things really depend on the individual's desires and or needs. Really, the focus of harm reduction is improving the quality of life of that individual. So really, any step that reduces harm to individuals, their loved ones, their family, their community, ultimately their society, really should be embraced and celebrated. As you can see, we're going to outline 4 different key benefits of harm reduction today. The first is public safety. When we take a look at harm reduction, we recognize that it really strengthens public safety by preventing disease transmission and injury, which then translates into less demand on those that are providing those medical services. We also know that harm reduction reduces infectious disease transmission among people who use substances, and this is through equipping them with different sterile supplies, accurate information, and facilitating referrals to resources. As we take a look at another benefit of harm reduction, that's healthcare cost savings. A fun little fact to share with you today is that research has shown for every $1 to $2 spent in harm reduction services or supports, approximately $5 to $7 in healthcare costs are saved. Another thing to consider is that harm reduction reduces public nuisance fears and concerns by offering folks a place to use drugs safely and safe disposal of syringes and other supplies. And then the biggest component too here at hand is that access to care and treatment, right? One fact that we'd like to share with you today is that approximately only around 1 out of 10 people with a substance use disorder have received treatment. And ultimately, harm reduction organizations, services, and supports can help fill that gap. This is ultimately, provide services to people that are needing to make that positive change in their life. Harm reduction also really provides multiple entry points for people into services, including treatment, but it also develops those meaningful partnerships between community groups, public safety groups, business groups, and public health groups as well. Lastly, to conclude with this slide, it's important to recognize that harm reduction supports really provide a space for people to be open about their substance use. So therefore, it's not hidden, which oftentimes can perpetuate feelings of isolation. So the next couple slides, we're going to take a look at what you can specifically do as it pertains to harm reduction. The first slide that we're going to take a look at is education. Thinking through harm reduction education, this really includes any type of information, knowledge, and the application of that knowledge. This strategy, can look like a wide variety of ways. It might be as simple as peers in recovery, educating people who are actively using or in early recovery themselves. It could also be education on how to prevent overdoses, how to reduce that risk in many areas, but also equipping yourself just generally with the training and resources needed around harm reduction. As we take a look at trainings and resources, we're going to be providing a list of various online resources and trainings that each of you can access and view after our meeting today. We really challenge each of you on this call to further educate yourself on the benefits of harm reduction and really the steps within our community that can be taken to reduce overdose deaths. Really, as we equip ourselves with proper education and training, we can then therefore empower the people around us to better understand how harm reduction works, which will ultimately reduce stigma and shame around substance use. A big component of harm reduction is that stigma reduction, right? Ultimately, harm reduction is oftentimes stigmatized, and it can look like a wide variety of ways. Some of us may have heard one of the following stigmatizing phrases before. We may have heard that, implying people who use substances are diseased, right? Maybe they don't have control over themselves or that they can't be trusted. Maybe we have been told or we have heard that people who use substances, they don't care about themselves or their community. We may have also heard that, people who use substances, that they are morally corrupt, they're untrustworthy, they're dangerous to children and the community. And again, at the end of the day, all of these things are rooted in stigma, right? And we can work together as a community to start breaking down those lies that we oftentimes hear. One thing that we as a council have previously talked about, and I'd like to re-highlight that in our conversation today, is using what we consider to be person-first language. So a person at its core, right, is a person first, right? And a behavior is something that can change. So terms like drug addict or user really imply that someone is something instead of someone, right? So we encourage all of you to be mindful of how you're engaging in these types of conversations as it pertains to individuals who use substances. You know, stigma can oftentimes be a barrier to care, and we want people to feel comfortable when accessing these types of services and supports. People at the end of the day are more than their substance use, and harm reduction really does focus on that whole person. The second component that we're going to talk about today is what you can do as it pertains to accessing some of those harm reducing tools, right? So that's all around providing access to tools such as syringes, Narcan or naloxone, safe consumption sites. That is also as a reducing or a harm reducing tool, right? And all of those things are about bringing care to the person through different mobile health services and supports. So really increasing access to those things. As we take a look at our community, we really encourage each of your organizations and agencies to have Narcan readily available. A part of this process really means ensuring that you, your staff, your volunteers, your leadership team are all educated on Narcan and are familiarized with how to administer it if an overdose were to occur. If you or your agency are interested in Narcan or receiving a Narcan training, we will be providing Randy Derrick's contact information a little bit later in our presentation. She is Chestnut's Narcan provider and would be more than happy to get in touch with any of you if this is something that you're interested in. Also, if interested in receiving fentanyl testing strips, folks can also reach out to Randy Derrick. Our supply is currently limited, but there is a potential for ordering some more if a need is present within the community. As we take a look at some other harm reduction, reducing tools and access to these types of tools and services, it's important to note that Jolt Harm Reduction, which is based out of Peoria, Illinois, has recently started to bring mobile-based services throughout McLean County, usually a couple days a week. So our team is actively seeking out some additional information on where and how and when folks can access these services, and hopefully we will have more information to share with the council sometime very soon. The next component that we're going to take a look at is support, right? And support is a key attribute of harm reduction. It's really the concept of helping with low or no barriers to care. Support oftentimes provides options that have minimum requirements for participation and normally address some of those basic health and social needs of people who use drugs. So this may include things such as primary health care, housing, homeless support services, medications, but even social, cultural, and faith-based supports. The four key components that you see on the screen are what we consider to be wraparound services and or supports. So wraparound differs from many other delivery strategies in the fact that it provides a comprehensive, holistic, individual-driven way of responding when someone is experiencing a crisis. So wraparound really puts that individual at the center of their care, examining the whole entire person and every single need that they may have. With support from, a wide variety of teams of professionals and supports in our community, right, that individual is really able to ensure that their basic needs are taken care of as they work towards their individual recovery. The fourth area is the ability to link individuals to needed services. So we really need all four of these areas on the screen to optimize the impact of services as they are truly all interconnected. As we take a look at McLean County, it is important to educate yourself and your team on the various mental health and substance use treatment resources that are available in our community, but also how can folks access those types of services and what does that referral process look like? Really knowing this information, you'll be able to connect folks to the appropriate avenues of care. Something to remember too is that oftentimes there are wait lists that can prohibit individuals from receiving immediate treatment. And something to consider in that process is that peer support specialists can be a linkage as folks are waiting to receive clinical care. So for those of you who don't know, peer recovery support specialists are individuals who are in recovery from their own substance use and or mental health challenges or disorders. And their life experiences in a recovery really allow for them to provide recovery supports in such a way that others can benefit from their experiences. So support specialists really promote that philosophy of hope, but also that philosophy of healing, right? By employing people with lived and living experience in leadership positions, right, that can engage them in the planning, implementation, and evaluation of some of these services. So if you are interested in learning a little bit more about peer recovery support services and what that looks like in our community, or just really having a better understanding of where you can go to connect folks to those services, that is something that our ROSC Council would be more than happy to connect with you on. So as we start to kind of wrap up our conversation again around harm reduction, we really want you to remember that August 31st is International Overdose Awareness Day. So really this is a time to remember, a time to support, a time to inform, but also a time to be thinking through how can we as a council, as individuals, as agencies, work together to prevent overdoses across our community. So if you or your organization are interested in implementing efforts for International Overdose Awareness Day, or maybe you're even just seeking guidance on how to properly do so, again, please reach out to our ROSC Council and we would be more than happy to help support you. I'm going to now turn it over to Kat to discuss some of our harm reduction resources that we have collected for you today.
Sorry, I was on mute. I forgot I was. So for this meeting, we wanted to go ahead and collect just a different array of different harm reduction and related resources. To start out with, we have the link to International Overdose Awareness Day, which is an observance of not just overdose awareness, but also overdose prevention. And then there are a couple of different harm reduction coalitions at the national level, but also at the state level for Illinois. And we also shared a couple of different organizations across the state that have engaged in developing harm reduction strategies in addition to jolt harm reduction. And then finally, for our last resource, this is something that was developed as a community member reached out to us back in June, looking for ways to go ahead and honor their loved one who had passed away due to overdose. So this resource is accessible through the Google Drive. And our next slide will show where you can also access these. It includes different websites that are digital memorials to go ahead and add pictures, maybe a quote, also stories or artwork to memorialize that loved one who passed away. We also included information on the grieving process, specifically for the situation of losing someone to overdose. And then we also have, as if people are wanting to get more involved with harm reduction, overdose prevention, we included some resources that go a little bit more into education and overdose awareness. And then if Carrie, I'll come to our next slide. This is the QR code for our virtual resource app. We have all the harm reduction resources that were listed on the previous slide, along with other great resources going forward to helping to support your recovery. for whatever needs you might have.
Thank you, Kat. Before we move forward today, we'll just go ahead and take a moment to do a quick pause to see if anyone has any questions or follow-up thoughts from what was shared today around harm reduction and International Overdose Awareness Day. All righty, we'll go ahead and move on with our conversation today. Alrighty, so again, here is the contact information for Randy, who is again the Chestnut Narcan provider. So if you, your organization, or someone that you know is interested in a Narcan training and or receiving just Narcan in itself, please feel free to reach out to Randy. She's on the call today, but her email address is also provided there on the screen. And again, as was just previously mentioned, if you or your organization are interested in receiving some fentanyl testing strips, again, our current supply is limited, but please feel free to reach out to Randy if some of those needs arise. Alrighty, I'm going to go ahead and turn it over to Barb to provide some highlights and updates for our National Recovery Month event that our council is planning for September.
Thank you, Carrie. Well, I first just want to thank everyone for being here. I mean, this is great. And we really appreciate you taking out your time to come to our council meeting once a month. It's very much appreciated. I love to see all the faces, and just want to let you know, we'd like to invite you all to our 4th annual McLean County ROSC Recovery Month event. It's going to be on September 30th this year, Saturday, 5 to 8 p.m. out at Anderson Park. And we will, right now we have 17 resource tables signed up to be there. And we'll have guest speakers, games, activities, arts, crafts, some raffle baskets, just a lot of fun. We'll have food and drinks supplied as well. And we'd love to see each and every one of you. And also I'd love for you to share this information with whoever you'd like. The more the merrier. So we're really looking forward to this event. We're going to end it in a recovery walk, and it's turning out to look like it's going to be a really great event. And also more room for more resource tables. So if anyone wants to sign up for that, there's a QR code here, and you could go ahead and sign up to be there. And I think that's our biggest thing. That's our big recovery event. And we would love to see all of you, and love for you to share this information however best works for you.
Awesome. Thank you, Barb. Any questions or concerns around our National Recovery Month event that we are planning? Okay, we'll go ahead and move on to our next slide. All right, and Barb, I'll let you lead this one as well.
Sure. So this is another thing called action here. We have the McLean County ROSC virtual resource app, and that QR code right there will take you right to it. And if you have any information, any resources you'd like to share and add to the app, just please email us at mcleancountyROSC@gmail.com. Or you can just fill out the form below, and we will get your resources added to our virtual resource guide, which it has a lot of great information. So I would love to have you check it out.
Thank you, Barb. I believe that QR code will actually take folks to a form that can be filled out for them to submit some of their own resources. Either Kat or Barb, if you wouldn't mind putting the link to the resource guide in the chat so folks have access to that. But at any point, as you or your agencies recognize that there's new flyers or events coming that you would like us to post on the app, please feel free to fill out that form that, again, can be scanned by that QR code, and we as a team will work together to keep that app updated as much as we possibly can. All righty, I'll turn it over to Kat to talk a little bit about the planning committee and the great work that they have been up to.
Yeah, so we are super excited as we are getting closer to Recovery Month. We are currently meeting weekly on Tuesdays at 11 a.m. and we've got 2 to 3 new planning committee members, which makes me so happy. If you're interested, we would love to have people. This is a great opportunity to come contribute your ideas for future planning that we're doing. As we get closer to Recovery Month, we'll be winding that down and we're moving our eyes ahead to the rest of the year. So we would love to have anybody come and, share their ideas. And if you are interested in joining, you can go ahead and email me. My email here is on this slide, and it's also with our contact info at the end of the presentation.
Awesome. Thank you, Kat. Alrighty, we have entered that part of our presentation that we are going to just take a quick pause and see what updates each and every one of you would like to share with everyone on the phone call today. We would love to hear if anyone else has any national recovery events coming up or just fall festivals, things that you're looking forward to, or just areas for collaboration. So I will leave the floor open to whoever wants to share first.
I can go first. So Michelle from the Bloomington Public Library, just to let you know, we're doing a little flip-flop in the next month or so. We're going to be moving to the other side of the library. And so you'll find a new entrance. You'll get to see a glimpse of what the new library is going to be like while they renovate the other side of the library. So just be patient with us as we make those changes. There may be a day or so that we're down, so plan ahead for that. And then we're not open, but on the move also means that the bookmobile is still running. And so if you can't find us here at the library, come find me on the bookmobile. Also, I'm a part of the McLean County Reentry Council. And we're having a town hall in conjunction with End Permanent Punishment organization and also the Fully Free organization to make, once a person has paid their dues and served their time, that then they wouldn't have repercussions for the rest of their life, no matter what they've done to come back into the community in a good way. So that will be held at 6 p.m. at the Junction on August 23rd. So that's a Wednesday. We'd love to have you there to support. I think that there's a big crossover between recovery and reentry. So yeah.
Wonderful. Thank you, Michelle. I'm excited to see the updates and renovations to the library.
Yes,
I think that will be a wonderful transformation. So thank you.
I may have to dress nicer. I mean, it's that fancy.
Yes. I love it. Well, we're excited to see it. Thank you for providing some information on the collaboration with the Reentry Council as well. Michelle, if you have any additional information, including flyers or educational materials around that, feel free to send it to us and we can add it to the community calendar on our resource guide. All righty. What other updates do folks want to share? Randy, I see that you unmuted yourself. Go ahead.
Sure. Yeah. So I'll provide a quick update about BN Parents. We cover the Bloomington Normal area, mostly schools with substance use prevention messaging, more environmental level things. So we've been extremely busy the past couple of weeks getting ready with back to school things. Our program that we do in the schools is called What's Your Superpower? So it is, the theory behind it, the wellness wheel is kind of what inspired us for that. So we focus on a different area of wellness every month this year. So starting off the beginning of the year, it's Happy Camper. So we're going to have posters all over our schools, out in the community, as well as on our social media promoting that. And then stick around for next month. It's a surprise what our next month is. And you can follow us on Facebook, look at all that. So very busy with that. The Narcan side, I've been training a lot of individuals on Narcan, getting a lot of things out there. So that's great to see. And then just so everybody knows, there has been some bad batches of methamphetamine that is laced with fentanyl. So if you do have any friends, family members that are using methamphetamine, please let them know that and get the fentanyl test strips that I have, just as a PSA.
Awesome. Thank you, Randy. Our team was recently at Chestnut Health Systems Wellness Festival, and we passed out 30 boxes of Narcan to community members. So a huge success there, and very thankful for Randy and her team with Being Parents and all that she's doing with Narcan as well. So thank you, Randy, for that update. Alrighty, what other updates do folks want to share? What else is going on? What else can we do to collaborate with you? Emily, I see that you were unmuted. Go for it.
Yes, I would love to go next. As I mentioned earlier, I'm with Brightpoint in the Scott Early Learning Center. We have Head Start and Early Head Start programs doing daycare and preschool. We're able to serve 6 weeks to 5 years old, and I am so happy to say we have hired 8 new teachers. So we are opening a ton of classrooms. We had a wait list previously. There were some folks waiting over a year. Our wait list was like 200 kids long. So we have actually made it through quite a bit of our wait list, and we've got some spots open. So we have a new school year starting on September 5th. I'm not sure if they were to put in an application now that they would be able to start September 5th, but at least the wait should be shorter than it has been previously. So if you've got any folks looking for childcare or just want to put in an application, even if they're currently pregnant and want to get on the wait list as they're waiting to have their baby, they can certainly contact us and we'd be happy to work with them. I can throw my email in the chat if you would like to contact me to find out more or get connected with our enrollment specialist.
Awesome. Thank you, Emily. That's really exciting. Always such a good feeling to have some positions filled. So that's great to hear. And yes, please feel free to put your contact information in the chat for folks. Alrighty. Any
Hi.
other? Oh, yeah, go ahead. Frida.
I'll try. Okay. On September 9th at Comer Cox, we're having a recovery event. We're going to have speakers, entertainment, art projects for kids, food will be provided. We're really looking forward to it. We will post that on Slack, and my coworker that knows all about this computer stuff, she's going to put it in the chat for us, and we'll put it on Slack. So you get the opportunity. I know you're kind of far away, but we'd love to have you.
Awesome. Thank you.
And with that, Fran, we're more than happy to go ahead and share that on our social media as well.
That'd be great. Thank you.
You are welcome. We will add it in there. And Courtney did put the save the date for that in the chat. So if any of you folks are in the Springfield area on September 9th, I'm sure they would love your attendance. Alrighty. Any other final updates, questions, concerns, big ideas, areas for collaboration? Okay, I'll go ahead and re-share my screen for just a couple of our last final slides here. Alrighty, so again, we went through our agency updates today. Just again, a friendly reminder of all of our contact information. There is a lot of great work happening in our community, and we love to hear from you. So as new events are coming into the picture, or as you have specific information that you would like support with, or would like our council to share on behalf of your agency, please feel free to reach out to any of us here on the screen. Kat, Barb, and myself, we are oftentimes checking our McLean County ROSC Gmail account, so you are always welcome to reach out to that as well. One quick plug that I do want to make is that our virtual resource app is on business cards, and we have hundreds of them in our office and hoping to order more here again soon. So if you or your agency would like some of those business cards to keep on stack at your agency, or just to pass out when you are directly out in the community, feel free to reach out to the one of the three of us, and we would be happy to swing by some cards to your facility. Alrighty, and if there are no additional questions for today or thoughts, we will go ahead and conclude our meeting, with our next meeting being on Tuesday, September 19th from 3:30 to 4:30 p.m. via Zoom. And we hope to see many of you there, as well as our event at the end of the month, which again is September 30th from 5 to 8 p.m. at Anderson Park. So thank you all for joining us today. We hope you have a wonderful day, and please feel free to reach out if you have any questions or concerns. Take care.
Bye, everyone.